As you mentioned, we have to do all the things for MCAS, right? And you were mentioning quercetin's problem with ferritin, but do you see, or do you have a thought on, high-dose quercetin affects GABA, and we're trying to modulate GABA via, vagal and other peptides and et cetera. So, there's like a rob Peter to pay Paul effect. How are you balancing that out?
It's having that knowledge and now saying, yeah, that's a problem. So I'll try and rotate things. I'll use other things. I really love apigenin and luteolin. I will use, I use a product, obviously we use it for our gluten-sensitive patients that contain DPP-4 and contain those. For some patients, it's really helpful. I use other agents basically, and I try, not all patients will have that problem with GABA issues or ferritin issues, but if I see it, or I have a patient who already has, hypoferritinemia and malabsorption and all this other stuff, and I might not want to use it, I've got all these other tools, to potentially modulate. So I'm just really, cognizant of that. And we have, because, like I said, I'm an MD that can prescribe. I use a lot of ketotifen. I use a lot of cromolyn. I use a lot of agents in addition to the LDN to just get their mast cell bucket down as well as I can. And I give them expectations too, that every person is different, and we've got to find the fulcrum that then allows the rest of it to come out, and then just really opening their detox pathways is a really, really huge thing. They're just blocked in so many ways.